All right, let's dive right into this explainer. Today, we're exploring the fascinating cellular battleground of spasticity and the absolutely incredible biochemical marvels we use to treat it. If you've ever wondered exactly how modern medicine can take a muscle that is literally locked rigidly in place and somehow coax it back into a state of relaxation, well, you are in the exact right place. We're going to open the hood on the human nervous system today.
So what actually happens when your brain just loses its ability to tell your muscles to stop? To figure that out, we're going to use cerebral palsy as our anchor today. It gives us the perfect lens to understand what occurs when upper motor neurons, which are basically the master commanders up in our brain, get damaged, and how that damage trickles all the way down to create total chaos in the muscles. Here's our roadmap for today. 1. The reality of spasticity. 2. The neurotransmitter tug-of-war. 3. Central nervous system relaxants. 4. Peripheral nervous system relaxants. And 5. Why muscle relaxation matters.
Section 1. The reality of spasticity. You know, spasticity is really, at its core, a massive issue of miscommunication. When upper motor neurons in the cerebral cortex are injured, which, by the way, can happen from things like premature birth, intrauterine infections, or just a lack of oxygen to the fetal brain, the vital downward signals to the lower motor neurons are heavily disrupted. Basically, the brain is frantically trying to send signals down the spinal cord, but the telephone lines are completely severed.
Now, looking at these classic signs, they show us exactly what goes wrong when muscles lose that top-down neurological supervision. Without the upper motor neurons playing boss, the lower motor neurons become insanely oversensitive. So you get hyperreflexia, where even a tiny tap on a tendon causes this massive jerk. You see clonus, which are these wild, involuntary rhythmic contractions. And most notably, you get intense spasticity, a profound, lingering increase in muscle tone that makes movement incredibly stiff and just flat-out difficult.
Section 2. The neurotransmitter tug-of-war.
So let's zoom into the spinal cord for a second. In a healthy nervous system, you've got this beautiful, delicate, continuous balance between two main neurotransmitters working on your lower motor neurons. Think of GABA as your body's neurological brakes. It's an inhibitory messenger that calms the nerves down and stops them from firing. On the flip side, we've got glutamate, and that is your gas pedal. It's a stimulatory neurotransmitter that commands those lower motor neurons to fire, which tells the muscles to contract.
So here's the crucial takeaway. Spasticity is basically a microscopic conflict where this balance is entirely shattered. Because of the initial brain injury, the inhibitory signals, the brakes, are failing, while the stimulatory signals, the gas pedal, are totally unchecked. This leaves the lower motor neurons constantly firing, which, you guessed it, leaves the muscles constantly contracted. Section 3. Central nervous system relaxants.
This brings us to how we actually treat this, using some brilliant pharmacological tools. Central muscle relaxants intervene right at the spinal cord. Medications like baclofen and diazepam, they specifically target the GABA receptors. They step in and essentially stomp on the biological brakes, amplifying those calming signals to quiet down the overactive neurons. On the other hand, we have tizanidine. Instead of hitting the brakes, tizanidine blocks the release of glutamate. So it's basically lifting the foot off the stimulatory gas pedal. Both tactics ultimately lower that firing rate, allowing the spastic muscle to finally get some rest.
But hey, what happens when just swallowing a pill isn't cutting it? If oral meds fail, or if they cause way too many side effects, doctors have a pretty amazing surgical backup plan. They can implant an intrathecal pump. This tiny device pumps baclofen straight into the fluid surrounding the spinal cord. It completely bypasses the digestive system, delivering those breaks exactly to the source of the problem.
Section 4. Peripheral nervous system relaxants. Now, to wrap our heads around this next set of drugs, we gotta quickly review how a nerve normally talks to a muscle at the periphery. Usually to execute a movement, a tiny vesicle inside the nerve cell fuses to the membrane. It then dumps a chemical messenger called acetylcholine into the gap, which binds to the muscle and stimulates it to contract.
And this is exactly where botulinum toxin comes into play. Yep, that's right, the very same Botox people use for cosmetic wrinkles. When doctors inject it directly into a spastic muscle, Botox intercepts the signal right at this junction. It physically stops the fusion of those nerve vesicles. No fusion means the acetylcholine is never released. The command to contract just never reaches the muscle, so that specific localized muscle stays perfectly relaxed. Okay, let's zoom in even deeper, right inside the actual muscle fiber itself. For a physical contraction to happen, a structure inside the cell called the sarcoplasmic reticulum has to release calcium.
That calcium then activates these microscopic cross bridges that slide past each other, which creates the physical shortening or contraction of the muscle.
Enter a drug called dantrolene. This one's a real game changer because it bypasses the nerves entirely and hijacks this exact cellular step right inside the muscle. It traps the calcium, stopping it from being released from the sarcoplasmic reticulum. And without that calcium, those cross bridges can't activate. The muscle simply cannot contract. It's a genius way to reduce spasticity right at the mechanical source.
Section 5. Why muscle relaxation matters.
You see, breaking this cycle of spasticity, it isn't just about restoring graceful movement. If we don't treat it, the consequences are incredibly severe. Constant muscle tension leads to intense, chronic pain. Ironically, it also causes muscle weakness and atrophy, just because the muscle isn't being used through its normal range of motion. And worst of all, over time, that relentless, unbalanced pulling can lead to permanent joint contractures, dislocated hips, and severe spinal deformities. We literally have to relax the muscles in order to save the skeleton.
Now, as absolutely amazing as these biochemical marvels are, they're honestly just one piece of a massive, holistic puzzle. You can't just hand a patient a muscle relaxant and call it a day, right? Managing something like cerebral palsy demands a huge multidisciplinary approach. Patients need physical therapy for mobility, occupational therapy for daily tasks, and often speech therapy and nutritional support, because remember, spasticity can easily affect the muscles we use for talking and swallowing too.
This quote right here perfectly captures the reality of the situation. It highlights exactly why all of this matters so much. We currently can't reverse the initial brain injury that caused the upper motor neuron lesion in the first place, but through incredibly targeted pharmacology, literally mastering the brakes and gas pedals of the nervous system, and through comprehensive therapy, we can actively manage the complications and drastically improve a person's quality of life.
So we've traveled from the brain down to the spinal cord and all the way into the calcium inside a single muscle fiber. It truly leaves us wondering, with these incredible pharmacological tools already rewriting the rules of muscle control, what does the future of neuropharmacology hold? How much further can we push the envelope to restore completely pain-free movement? It's a fascinating frontier, and I really hope this explainer gave you a clear, inside look at exactly how we are fighting that battle today.